Since the beginning of the opioid crisis in 2017, the number of deaths due to the opioid overdose in Simcoe County has been going up. In March this year alone, 23 people died. Compared to the first 6 months of last year, this year there are 50% more deaths due to opioid overdose. Barrie has only 29% of the county's population, but 50% of its overdose deaths. According to the US-based think tank Drug Policy Alliance, there are around 120 supervised consumption sites operating in 10 countries, including the US, Australia, France, Germany, Switzerland, and Canada. More than 100 evidence-based studies have proven the positive impacts of supervised consumption services, such as reducing the amount and frequency that clients use drugs, reducing public disorder and public injecting while increasing public safety, reducing HIV and hepatitis C risk behavior, that is, syringe sharing and unsafe sex, successfully managing frequent on-site overdoses and reducing drug-related overdose death rates. There has not been a single overdose fatality at any SCS worldwide. Saving money due to a reduction in disease, overdose deaths, and need for emergency medical services. But despite these advantages, there are many misunderstandings and false information about them. Barrie City Council approved the only supervised consumption site in Barrie this year. The proposal is with Province of Ontario for approval. After that, the federal government needs to provide the final green light. As the province is weighing on the proposal, MPP and Attorney General Doug Downey started a new survey on his website asking residents to provide their feedback. Simcoe Muskoka District Health Unit already held neighborhood consultation before the council approved the site. The new survey could potentially delay the approval process that has been going on for more than 2 years. Sensing the urgency of the matter, local leaders, including Mayor Jeff Lehman, wrote a letter to Ontario and federal governments urging immediate approval of the site. Other signatories of the letter include Simcoe County Warden George Cornell, Chief Executive Officer of Royal Victoria Regional Health Centre Janice Scott, and Chief Executive Officer of Simcoe Muskoka District Health Unit Dr. Charles Gardner. We talked to the Associate Medical Officer at Simcoe Muskoka District Health Unit Dr. Lisa Simon. She is also its lead on the Supervised Consumption Site project. We discussed the common misconceptions about the sites, the process followed to approve the Barrie site, the gravity of the opioid crisis, and what are the solutions to control it and save lives. Hello, doctor. How are you?
Fine, thank you. How are you?
I'm good. Thank you. I wanted to talk about the supervised consumption site that has been proposed in Barrie's ward number 2, and community leaders, including mayor of Barrie, signed a letter supporting the supervised consumption site that has been approved. So I just wanted to get a sense that the process had been going on for more than 2 years. It started, I believe, in 2019. And it has been approved this year. So as a medical professional, as a doctor, how would you talk about the approval process in terms of assuring the Barrie residents about the process and what the supervised consumption site means?
Sure. So in terms of the approval process, and even to just back up to how long it has been going on, we started working on this very actively in 2018, and in fact did a number of general consultations and awareness raising with the Barrie community in that year, and brought forth the first proposed site to Barrie City Council in 2019. That particular site wasn't supported, and so then we went back and started on the current process that has led us to the current site. So that the process the second time around started in 2019, but just to indicate that there had been significant work even prior to that. So with the current work, as you say, yes, it did begin in 2019. And essentially what happened from 2019 to mid 2021 is that we had an SCS site selection advisory committee, which was made up of a wide range of individuals and organizations who could help advise the Canadian Mental Health Association Simcoe County branch and my own organization, the Simcoe Muskoka District Health Unit, in terms of how we should go about the site selection process and the community consultation process. So that advisory committee was in place. We met with them regularly, and they helped as our organizations then developed a very fulsome, comprehensive approach to looking at where there was a need for these kinds of sites, looking at what the criteria were provincially and with local consideration. And then we did a number of real estate searches, found a number of sites, and narrowed those down to a selection of sites that we thought would be appropriate for consultation. That then went through online surveys for the whole Barrie community and some virtual neighborhood sessions for people who live near those proposed sites. And through that process and through some engagement sessions with City Council, we did end up having a short list of sites, and eventually the applicants, and through the advice of the advisory committee, did choose 11 Innisfil Street, also known as 80 Bradford Street, Unit 940, as the proposed site to move forward, which was the site in our perspective that best met all the needs that we were looking to meet, all of the criteria that we were taking into account to really serve clients effectively and to be a reasonable fit in the surrounding community. So we brought that site forward to Barrie City Council for their endorsement in May of this year. We did receive their strong endorsement, and so then that allowed us to complete the applications and submit them to two levels. So we have submitted them to the federal government, to Health Canada, where we are seeking an exemption from the Controlled Drugs and Substances Act. So that's one piece that we need. And then the other piece is submitting an application to the provincial government for funding for this consumption and treatment services site. So currently where we're at is we're waiting to hear back, both from the federal level and from the provincial level. Both applications are being led by the Canadian Mental Health Association. So it is really them who's leading that aspect of the work in the exchange with both levels of government, and the health unit is doing what we can to support that process. And in the meantime, while we wait, we are very much available for ongoing conversation and awareness raising about the purpose of the site and about what we can do to help ensure that we meet the needs of the surrounding community if in fact the site is approved at 11 Innisfil Street.
Yeah, the reason I wanted to start with the approval process is I know the opioid crisis has been really hard on Barrie, but I wanted to first help understand what has the process, the comprehensive process you talked about that has been followed for more than 2 years. I get a sense that it is not something that has been rushed through. It has been going on for a while with the experts participating in the process.
It has been an extensive process, a very collaborative process, a very comprehensive process. And absolutely, we have had everyone from health experts and officials to social organizations, to people who use drugs, to local residents, to local businesses and the Business Improvement Association participating in the conversations along the way that led us to our current site selection.
Yeah, no, that's helpful, because I am a parent, and when I talk to my wife, she also wants to know about, how these sites come into existence, and most of all, what goes on in these sites. So if you can, talk a little bit about how these sites operate and the safety that, some resident might be worried about.
Sure. So I can talk a bit about what the sites actually do and then about kind of what they help achieve. So what a supervised consumption site is a place that people who use drugs can go to that provides a safer space to use their pre-obtained drugs under the supervision of healthcare staff. There are also a wide range of other services that are available via supervised consumption sites or consumption and treatment service sites. And just, I'm using those two terms a little bit interchangeably. SCS is the broader term and the federal government uses that term. CTS is the term that the provincial government uses. In terms of the specific services that you can expect, broadly speaking, at this kind of site. So one is, when individuals are using their pre-obtained drugs, one of the key points of the site is to be available for overdose prevention or response. We also would have, or CMHA would make available harm reduction supplies. So things like needles and other safer drug use equipment, as well as take-home naloxone and potential for drug checking services. There's also client education that's available around risk reduction. And then finally, there's connections to a wide range of services that are made available. So that includes addictions and mental health treatment, primary care, and housing, and a number of social supports. So all of those, of course, would be dependent on what that individual is looking for at whatever point that they're at in their life. So that's the purpose of an SCS or a CTS and the kinds of services that are available. And in terms of what to anticipate, SCSs are not new. They have been operating for decades now, actually. And because there has been a history of some questions or concerns perhaps about these sites, they have actually been quite rigorously researched in the scientific community. And a number of high quality studies have been published about them. So we have a pretty good sense as to what we can anticipate when a site is run well. What can we expect to see from it? And we know from reviews that have been done that pull together these experiences from sites in Europe, in Australia, and in Canada, which are some of the areas that have the most supervised consumption sites. What can we expect to see based on what the research tells us? And there are a few areas. So certainly there are a number of benefits for people who use drugs themselves. And certainly, that's part of the core rationale for pursuing them. So one of them, of course, is to decrease overdose deaths and hospital visits, which I think for us would be the thing that we would most hope to see given the really tragic and urgent opioid overdose crisis that we're facing in our community. Secondly, would be that these sites help to reduce unsafe injection practices for people who inject drugs, which we know would help to lower the risk of transmitting hepatitis C and HIV. And again, in our community, hepatitis C has actually been on the rise for the past number of years. So I would be hopeful that this site could help in part address that trend. And thirdly, a key benefit for people who use drugs is that these sites help to increase access to health and social services. So I mentioned before that those services are offered, but we know from the research, people actually take up those services. People are more likely to access addictions treatment and mental health treatment when they're able to go through a supervised consumption site for some of the individuals who use these sites, given that often users of an SCS may be marginalized and otherwise face stigma or other challenges in accessing mainstream health and social services. So they may not just walk up to the door of an addictions treatment program otherwise, but if they use a supervised consumption site and they build trusting relationships with the staff there who are very much focused on non-judgmental, low barrier, welcoming service, that can open the door for people to pursue next steps in whatever health or social need they may have that they may not otherwise have felt comfortable or able to do. So that's a bit about what these sites offer for people who use drugs, but then they also offer a lot for the surrounding community. And I think that's so important to emphasize, and sometimes gets lost in the conversation or the fear that people might have when they think about these sites. But what we know from experience elsewhere, in fact, is that these sites, they decrease public injection that may already be happening in the surrounding neighborhood, right? They decrease public drug use and public injection. They also decrease the amount of drug-related equipment that may be left lying around, whether that's needles or otherwise. And they decrease overall healthcare spending because people are now being able to be cared for, concerns are being prevented or addressed on site as opposed to in the broader healthcare system. And all of this happens, and this is really important, without seeing an increase in crime. There is not an increase in thefts. There are not an increase in drug-related crimes, and that has been demonstrated over and over again in multiple systematic reviews of the literature that there is not an increase in crime in the surrounding neighborhood. So while you may see some people coming and going, of course, to use the site, that's the intention of it. These sites are put in neighborhoods where there are already people who use drugs in that vicinity, so it can serve them well. And it in fact contributes to a safer and a better served neighborhood, as opposed to bringing any concerns to that neighborhood.
Yeah, so that's what my the next point was, and I was trying to understand is, because as you mentioned, the drug use over opioid crisis is already under place in Barrie. A lot of people are losing their lives. They are their neighbors. They are somebody's sons, daughters. Relatives. And what I believe the supervised consumption side does is, these people who are already in the background, they are bringing them to the foreground, and they are using this under supervised medical attention. And I think that's what is causing a little bit backlash, because now people can see these people using this drugs. And earlier there was much more bigger crisis, but that was happening in the background. And this gives the people impression that, and there are some rumors that is state offering them drugs for free. People sometimes believe that you can go and buy drugs at these sites. Criminals can come in, and and I believe Mayor Lehman addressed this issue in last town hall with Ward 1 and 2, that Barrie police will be there all the time, and they will be making sure that there is no illegal activities are happening. People are safe who are living in the neighborhood. Did you have any interaction with maybe Toronto sites where the safe in the consumption sites are? Any experience interacting with the users or the residents that you had?
Right. So I haven't personally worked at a supervised consumption site to be able to comment on that, but we have talked with many supervised consumption sites across Ontario, and certainly we're familiar with reports from many of them. And really it's similar to what I've been conveying. I think one example that we've looked at a lot, and I know a number of members of City Council have looked at a lot, is Guelph. And they have been very clear about their site having been fit in really well in the neighborhood where there was clearly already a need for that kind of site. Mm-hmm. And they have found that individuals have been able to use that site and come and go really along with users, a wide range of other users, because their site is part of a community health center. So all sorts of folks are in and out of there, right? There are parents with newborn babies, there are elderly folks, there are people from all walks of life using that facility, including individuals who are coming in to use the supervised consumption site. They have security on site, just like CMHA plans to in the proposed site for Barrie. And they have found, in fact, that it hasn't been an issue. People respect and understand the purpose of the site. There are trained individuals there to de-escalate if there are any concerns that arise, and that the various uses of that site and the surrounding kind of residential and commercial area has flowed well together. And I think that's really important to realize, is that this is an essential healthcare service, right? And it's a healthcare service that we put in the communities in which it's needed. And as to your point about the users previously not being obvious, I think in many communities it is obvious. I think a lot of people in downtown Barrie often see people who may be street involved or not, people who are using drugs in public settings, for example, or using them in shelters or other places. And people currently don't have a place to go that is safer than that, right? And that's what this site would offer, is a safer opportunity to use and an opportunity to be connected with other services.
And I couldn't help but share my personal experience. We, as part of when I was doing my master's at Ryerson, we did a documentary on opioid crisis during this pandemic, and we visited a lot of safe consumption sites in Toronto and interacted with the users most often. And even I did not know before, like, these people who are addicted to drugs, these are very compassionate people. They are oftentimes they are very nice people. They have many times they are taking drugs due to some mental illness or other factors, but these are not criminals. And at least we visited Moss Park. We talked to so many residents who are living at the Moss Park, and at no time this came to us as aggressive people or criminals or somebody trying to hurt. So I as an individual, and I would encourage Barrie residents to interact with these people and try to understand their why they are facing the addictions, and treat them as part of the community members. They are somebody's, as I said, daughters, sons. So I think that's compassionate attitude is very important. I can't help but talk about as an individual. And the next point, sorry, you were about.
I think that's an excellent point, and I'm so glad you've emphasized that. Is absolutely what you've said. I mean, these are individuals who are in a bad way for any number of reasons. No, nobody would choose the path of addiction and of leading a life where this kind of service might be needed. But people end up there for all sorts of reasons, whether that's past experience of trauma, whether that's a family history of addiction, whether that's mental illness, whatever it may be. People face hardship in life, and our job as health and social service providers and as the broader community, as you say, is to be compassionate, to understand that we are all human beings and we are all worthy and deserving and have the right to access the services that we need. But you're right, these folks are going to be just like any other folks that we may see and interact with. They're just coming for a particular service that might not be a service that the average person is familiar with.
Yeah, no, that's fair point. And I was just looking at the numbers, published by Simcoe County, and just this, first half of 2021, there is 50% higher deaths in Simcoe County due to overdoses than compared to the last year, which was again almost twice as 2019. So we see the crisis has been exacerbating a lot, and out of that, this year 39 deaths in Barrie. I think that's really astonishingly high number. And just one point about it, Barrie last year had 50% of the deaths due to overdose, and which has only 29% of the county's population. So it's very clear. And even if you are talking about broader province of Ontario, the similar population size, if we consider, Barrie has been seen a lot more death per capita than other cities. So the pandemic and the opioid crisis. So how do you see this unfolding if there is no safe consumption site in near future?
Mm-hmm. So you're absolutely right about the statistics that are astonishing, really, and hugely concerning. We have seen a dramatic increase on top of what was already hugely elevated rates of opioid-related deaths, numbers of individuals, of loved ones that have been losing their lives in this city and more broadly in our region. And as you say, already in the first 6 months of 2021, there have been 39 individuals who have lost their life in Barrie, which is a considerable elevation from last year, which was already more than twice the year before. So we are on a huge upwards trajectory, and the pandemic has made the situation a whole lot worse than it already was. I have no doubt, and I think any of us who are familiar with supervised consumption sites and what they can offer are well convinced. The evidence is clear that they will make a contribution to making the situation better. Will they single-handedly solve this problem? Absolutely not. It's hugely complex. There are a number of factors involved, and that's why we need a comprehensive approach with a whole number of prongs, right? A bunch of options for harm reduction and a bunch of options for treatment. We need everything that we know works, and a supervised consumption site is one prong that we know from elsewhere and from decades of experience works. It helps to reduce deaths. It helps to connect people with treatment, so that perhaps in the longer term, more deaths will also be averted. So I am very hopeful that if we were to see a site in this city, that we would start to see a slow improvement in the upwards trajectory that we've seen in the past couple of years.
Yeah, one of the things came out during the approval of the site at 11 Insefield Street was people saying let's not have a site, as you said, there are different approaches in harm reduction and other approaches, and people saying that let's not go for the site, let's go for some other alternatives. So how would you fit this particular site in the broader options that we have, and can you please talk a little bit about those options also?
Sure. So I think in general, in public health and in medicine, we want to know what are the effective options available, and we want to make all of those available if there are a number of effective options. And I think addictions and drug use more broadly is one of those situations where people are going to face so many different circumstances in their lives, and it's such a complex situation that you're never going to have one approach that works for everyone, which is why we really need a multi-pronged approach. So the first set of strategies that we can think about are harm reduction, right? And harm reduction is really about meeting people where they're at. It's recognizing that some people are going to continue to use drugs, even if it causes harm to them, but that we can offer services that lessen that harm in the meantime, right? Recognizing they may continue to use in the interim. So supervised consumption sites are a very important part of it. They are unique in the whole spectrum in that, of course, they don't provide judgment. They don't require people to stop or change their drug use if they choose not to, but they try to make that process safer so people are less likely to overdose and more likely to be able to connect with the services that they need. Other examples of harm reduction, another very key strategy in the past number of years in Ontario and elsewhere has been the availability of naloxone for people to take home. They can get it from many pharmacies, they can get it from the health unit, they can get it from many other social organizations. So if someone themselves uses opioids or somebody who does, then having naloxone with you to be able to intervene in the case of an overdose is another very effective strategy that we know has been helpful for us. And then another example of harm reduction is the availability of safer drug use supplies, whether that be for drug injection, for inhalation, or otherwise. On the treatment front, I would leave that more to people who are leading addictions treatment to comment on, but certainly we know that there are a number of medications that are available for people who use drugs, including opioid agonist therapy for people who have an opioid use disorder, and then a range of counseling services that are available and residential treatment options as well. So these are some examples of the whole spectrum of harm reduction and treatment services that we would want to be available. I think in the city of Barrie, we have many of those that are at least somewhat accessible, and many of them where there's efforts to further increase the access. But the one that is completely missing from the picture is a supervised consumption site. So it is simply a prong of the overall strategy that we really need to have in place if we want to be doing everything that we can to help address this crisis.
So if I understand correctly, is as you were explaining different things, is there are different reasons for people to get addicted to drugs, family trauma or mental health issues. And once they start taking drugs, it's more for them, it's not only treatment but also the harm reduction, and safe in consumption side is part of that. So as I understand, is it you mean to say this is more of an inevitable part of the entire trying to address the entire crisis, opioid crisis? Would you say that?
Yes, I would say it's an important part of addressing the situation, because as you say, different people are going to have a very different experience if they have a substance use disorder, right? Some people might be ready for treatment quite quickly. Some people may not be ready for treatment for a very long time. And so in the interim, right, if somebody, and even some people who are actively undergoing treatment may still continue to use, right, from time to time. So the point of a supervised consumption site is to have a place that is judgment-free, it is question-free, regardless of why you are using. At the point that you are at, in your substance use, if you're planning to use, even though of course, that there are options available for treatment, if it is not for you at this time to be pursuing treatment, if you are planning to use, this is a place where you can do it more safely, right? And at the same time, you can connect with whatever service you may otherwise be looking for if you're looking for it. So it's really part of connecting that whole. We can't make assumptions that everybody, who has a substance use disorder is going to want, or in particular going to be able to succeed with treatment from substance use disorders are chronic conditions that are lifelong, that are relapsing conditions, and we need to be able to tackle them from a whole number of fronts. And so people at any point in their trajectory, if they are using, need to be able to have a safer place where they can do so.
So what I understand is the safe consumption sites are also the best places for medical practitioner to to interact with the people who are facing the addiction. So this is
Yeah, they're one of the places. They're not the only.
Okay.
Certainly, someone can choose to go to any number of other treatment locations as well. Like we have a rapid access addiction medicine clinic in Barrie. We have, the Canadian Mental Health Association and a number of other service providers that provide addictions treatment if someone wants to go directly there. But if you want to access those services via the supervised consumption site, that's another opportunity to do so. And in particular, for people who may not otherwise on their own volition choose to go to access addictions treatment. Maybe they're coming there actually to use, but then one day they might say, hey, I'm actually ready to speak to that addictions outreach worker that I saw, in the other office, right? I've gone to know her. She looks friendly. Maybe let's have a chat while I'm here. It's that kind of, I think, informal opportunity almost. It's creating an environment and a hub of support at this kind of site for individuals who otherwise may not seek those kinds of services.
So these are also because there's a lot of stigma associated with using the drugs, and once Barrie is as we talked about, is one of the cities with highest rate of deaths due to opioid crisis, and we also know Barrie is more conservative part of Ontario. So it's once Barrie has a site, it also sends the message that this is no more a stigma. You are, though it's still an issue that needs to be dealt, but you are kind of welcomed. Society is ready to accept you as you are and provide you the resources to use. And one of the there was one discussion, I don't remember the name, but a lot of people who had the issues and community member participated, and they talked about we have the bars, people can go and drink alcohol.
Yes.
That is accepted in the society. But when it comes to these hard drugs, we trying to push them out of society. And once we start accepting them, then there is a sense that the society wants to accept us, and maybe whatever issues I have, I can live while dealing with this crisis and addiction. Is this what it is, like, from what I'm trying to understand? Or?
Yes, I think you said that very well. I think it certainly would contribute to reducing the stigma of using these particular drugs, because as you've said, there's a lot of other drugs that are well accepted in our society, right? Or at least better accepted. Everything from caffeine through to some degree to tobacco, and certainly alcohol is causes more burden, more harm to our society. Actually, is caused by alcohol than any other, than any illicit substance, actually. So, although opioids are clearly pushing that as well. So point being, we have chosen as a society which drugs are okay and which drugs are not for whatever reason, and which users are okay and which users are not. And so it's absolutely part of that reframe in that conversation that it's partly about how you use that substance and how it affects your life, right? But having this kind of service where, yes, people, these folks have a right to access these services, and they have, every bit as much worth and need for health and social services as anybody else. I think sends a very powerful message.
Okay, so my last question about the urgency. You talked about the comprehensive process that had been followed for the past 2 years, and now we see the council approved the site is with the provincial government, and then it will go to the federal government. And just the month of March this year, there had been 23 deaths, and I'm not sure, but I think at least part of those deaths could have been avoided if we had the safe consumption site. So how much urgency do you think these sites has, and how do you look forward to getting the sites and helping the people?
Yeah, so there's a huge amount of urgency if you look at the situation and the numbers that we've spoken about, and you speak to the families who have lost loved ones. Every time that there's an individual who's lost their life, who might have been someone who could have used a site, really, I think, feels like a tragedy for everybody involved, and in particular for families who are losing their loved ones. So I think all of us involved in this work and advocating for this kind of service would have loved to see this in place years ago. And I do think it's worth reflecting on the fact that most health services do not require the kinds of extensive process that has been required to put this particular health service into place. Okay. With that said, because of the kinds of questions and concerns that there may be with regards to this kind of site, there is a very rigorous process in place through the provincial application process and to some degree the federal application process. And so as we've spoken about, we've gone through that locally. We've gone through very extensive measures to get to a point of an application and a site that we think is the best option that we are going to find in Barrie, right? There's never going to be a perfect site that everybody is in agreement on, but we very much feel we have found the best option that's available. And we hope that the applications will be reviewed as quickly as possible and approved as quickly as possible at the provincial and federal levels. CMHA in particular is closely in touch with both levels of government, and both our organizations are offering whatever additional information we can to help expedite that process, and sharing regularly what we feel to be the urgency of the situation and the growing crisis that we're facing. Beyond that, clearly it's in the hands of the two levels of government to consider, but our hope would be that this would be expedited, as much as possible, so we could see this site in place as soon as is feasible.
In any message, anything you have to say to people who are now because as we talk, MPP Doug Downey on his website, conducting an online survey asking residents, especially who live nearby to the approved site, to go on and fill that survey. Any message you have for those residents about who are scared about their safety or increase in drug consumption or criminal activities in the area? Any message for those who are trying to make that decision?
Yeah, absolutely. So, we understand that there are some members of the local residential area around the proposed site that aren't happy and that do have the concerns that you've raised. And what we are very committed to, as we've said and as we've demonstrated, is continuing to work with them, right? We have, I think, listened as much as we possibly can. We have incorporated a wide range of recommendations into the strategies that would be in place to help keep both service users and the surrounding neighborhood safe, right? I've shared with you today already what the experiences have been of other sites. And I think those are some of the conversations that we need to continue to have with local residents so that they can begin to understand that this site actually probably, if it does get up and running, I don't think it's going to change that neighborhood. I think it's going to be actually not all that noticeable or distinct a service. Many other communities have found that there is a great deal of fear before the site comes in, but once it comes in, public comfort and acceptance increases considerably. When they see that this is a healthcare service like a lot of others, people will come and go from the site, and it's not actually quite the impact that people are concerned that it may be. So I think the more we have this conversation, the more we look at examples from other communities, I'm hoping we can get to that point of agreement. And in particular, a key next step for us, if we do get approval of this site, is to have an advisory committee set up where we can have members of the local community, residents, business owners, developers, social organizations, and in particular also service users of the SCS to come together all together to understand each other's needs and put or tweak systems that are in place to help make sure that this site benefits the people who are using drugs in the service and benefits the surrounding community.
Okay, that's really great to know. Thank you so much, Dr. Simon, for taking time and talking to me and explaining the real issues that the concerns that people have with this safe consumption side. Thank you so much for your time.
My pleasure. Thanks for your interest.
Yeah, thank you.
Bye.